Okay, Alice, let me try something.
Okay.
Raise your hand if you like being admitted to a hospital. Nobody's raising their hands.
I don't see any either, and I wouldn't expect anybody to on that one.
Hello, everyone. I'm Dominic Chianese, actor, singer, and I want to tell you that I'm a strong advocate for nursing homes.
And I'm Alice Bonner, a nurse practitioner with Advancing Excellence.
And today, we're going to stay out of the hospital.
Or at least show you how to help your residents stay out of the hospital if they don't need to be there. This is the last of our Advancing Excellence videos. It's on hospitalizations and readmissions.
Delicious soup and
What would you do in this situation?
some fish.
But I don't think I'll feel like eating tonight because I really don't feel very well.
Well,
Would you excuse me?
Something's wrong with Julia. Come here.
Mrs. Robertson?
Nursing home residents can have what appears to be a sudden change in condition.
I'll get some help, don't worry.
But often there are clues, even days before. Subtle changes in behavior or daily routines. Can you identify when something is amiss?
Mrs. Robertson? Mrs. Robertson, are you okay?
And how do you determine if someone needs to be transferred to a hospital? A hospitalization has many risks and can be traumatic for residents and families, but there are times when it is the most appropriate setting for someone to receive care. In making this decision, good communication is critical. Using a tool such as SBAR that documents the situation, background, assessment, and recommendations may be helpful.
In some communities, nursing homes and hospitals have been working together on cross-continuum teams, trying to break down barriers and get out of their silos, working together to reduce unnecessary readmissions that might result from poor communication or lack of information between those settings.
Programs such as Interact help hospitals and nursing homes communicate and manage residents across settings. And it does this by collecting and sharing data. Nursing homes can use the AE Hospitalization Tracking Tool and the Interact QI Review Tool together to drill down and conduct a root cause analysis of when and why transfers may be happening.
One thing that's really nice about the Advancing Excellence Rehospitalization Tool is that it collects a lot of data. We can look at a lot of different variables when we're trying to do the root cause analysis to see why our rate is where it is. We can look at the neighborhood or the hallways, if it's related to a provider, whether it's related to a day of the week. We can also use some of the Interact tools and monitor them on the AE tool. For example, the SBAR communication tool, which has been very valuable in reducing hospitalizations.
Based on your team's quality improvement review of what happened during transfers, you can enter key data on those transfers here. While the Interact QI tool helps you perform a root cause analysis that is actionable, the AE tool provides useful reports showing changes over time that you can share among staff.
We're still at 20%.
Direct care staff play a critical role in noticing subtle changes in a resident, since they're with residents for 8 hours a day or more. And with consistent staffing and staff stability, CNAs may notice changes that no one else, except perhaps family members, would detect.
A few days ago, Mrs. Robertson just wasn't acting like herself, and I didn't say anything, and, the nurse was busy, and it just didn't occur to me. And then tonight, her head was down at dinner, so there's something clearly wrong. I really wish I'd said something. I think next time I probably need to speak up.
Well, team, I am very, very happy to let everyone be aware that our rehospitalization rates are very low this month, and it is because of your hard work. You do make a difference. We have these certificates for you. I just want to extend our appreciation and congratulations to a great team.
Alice, it's been a real pleasure working with you on these videos.
And with you too, Dominic. It's been great. And hopefully this introduction to systems improvement will be helpful. It's really just a starting point for you and your team to begin thinking about what the issues might be in your nursing home, how to explore the tools and resources on advancing excellence, how to consider performance improvement projects or PIPs to conduct small tests of change, and how to enter and use data meaningfully in your improvement work. Think of it as a trailer for the movie, and now you really want to see the movie. So hopefully we've communicated that the circle of success, including the probing questions and measurement tools, provides an entire package for improvement work. You don't need to reinvent the wheel. All of this is there for you on the Advancing Excellence website, and it's free.
We want to thank Forest Hills of D.C., the staff and the residents. And we want to thank the millions of men and women who work in nursing homes, who strive every day to provide quality of life for older adults and people with disabilities in our communities.
Thank you. So long.
Bye-bye. Advancing excellence, making nursing homes better places to live, work, and visit.